Hello, Dr. D here with the last chapter, chapter 16, which involves infancy to old age, pediatrics and geriatrics. I don't know if I've ever seen those put in a book in one chapter before, but that's what they did, so we'll look at the words. Um, they begin with the neonatal period, which is typically the first 28 to 30 days. Different books use different exact number of days, but basically the first month of life. Neonatologists are pediatricians who deal with problems in newborns, typically premature newborns, but not exclusively. Full-term newborns can have problems too, and neonatologists intervene. They're a special type of pediatrician, and as you know, pediatricians are specialists in the health care of children and adolescents. Adolescents have their own specialty called pediatrics, but you don't hear that term used as often in everyday medicine. And all of the specialties we see in internal medicine and in surgery have a pediatric version. So, for instance, there's pediatric oncology for pediatric cancers, pediatric cardiology for children's heart problems. So, all the specialists that you see mirrored in adult internal medicine and surgical specialties, you see the same sorts of specialties but focused on children. All right, so they start right at the beginning with birth, actually before birth. Before a baby is born, he or she is called a fetus, and the adjective is fetal. That's right there in the table on page 433. We'd have pediatrics, pediatrician, APGAR score. That's one of the terms that they have not yet taken the person's name out of. It's named for Virginia Apgar, who back in the 20th century realized we didn't have a standardized way of assessing newborns and predicting whether they would need specialized care. So the APGAR score is named for her. Babies are assigned scores from 0 to 10. And if you're interested in that, there's a description, I believe, a brief description in your textbook. Moving on, some words we've already looked at in other chapters, but it's good to remember them. On page 435, you see cyanosis and cyanotic being the adjective form. That is blueness, the condition of being blue. Cyan, if you open your printer, that's the blue ink. So cyanosis means blueness. And a typical newborn that's perfectly healthy in the moments after birth has cyanosis of his or her hands and feet for the first moments, 2 hours of life. So cyanosis isn't always abnormal, but if it's more than a little bit or it persists throughout the whole child, then obviously a cause for great concern. Dyspnea, you remember from the respiratory chapter, means difficulty breathing. So a child, a baby who seems to be struggling to breathe, who is tugging, we say, or having retractions, where you can see the tissue around the baby's ribs going in and out, that would be a sign of dyspnea. The author of your book seems to have a particular interest in one heart disease, congenital, meaning present at birth, heart disease called tetralogy of Fallot. It's a type of congenital heart disease with multiple anomalies in the heart and its big vessels, and it is characterized by cyanotic episodes. The child will turn blue at intervals. Hyaline membrane disease, we don't hear that term as much anymore. It's been replaced by respiratory distress syndrome, or RDS. There can be other causes of RDS, but hyaline membrane disease is immature lungs that don't make enough of a substance called surfactant, making the lungs stiffer and causing the baby to have trouble breathing. Meconium we talked about in the last chapter. I think that's all there. We've talked a little bit in the nervous system about some of the words on page 437, like anencephaly, where the brain fails to develop inside the skull. It's not compatible with life. We talked a little bit about spina bifida in the nervous chapter, and you remember that is where the vertebrae don't close and part of the spinal cord is actually outside the body. That's one of the ones we mentioned is often not completely corrected, but certainly the impact is minimalized by prenatal surgery. That's one of the frontiers of pediatrics currently. Craniofacial means having to do with the skull and the facial bones, so a craniofacial anomaly, and there are many of those, but you're probably familiar with cleft palate. coming on down. Let's skip on over to page 439. These are some words you should know that are useful outside of pediatrics as well. Agenesis means it didn't develop. One place you hear it in pediatrics is if a structure in the middle of the brain called the corpus callosum that connects the two halves of the brain doesn't develop, we say that child has agenesis of the corpus callosum. Or if the aortic arch above the heart doesn't develop, we say it has agenesis of the aortic arch. Atresia means that it doesn't have a proper opening. So we see that with biliary atresia, where the bile ducts in the liver don't develop properly. Esophageal atresia, where the esophagus is not complete, where the tube is blocked. A fistula, on the other hand, is an abnormal opening to the surface of the body or to an internal structure. Phototherapy, in the context of neonatology, is what lay people call Billy lights, where a baby has neonatal hyperbilirubinemia or newborn jaundice, to use the more common term. And that is treated with phototherapy, either lights in an isolator incubator or a blanket that babies even sometimes go home with, a Billy blanket. Excuse me. On page 441, some other terms that you probably already know. Congenital means present at birth. Diphtheria is a disease that fortunately we don't see much of these days except in unimmunized populations. So it is a bacterial disease that causes extreme swelling and purulence in the throat, responsible for a lot of deaths before we had a vaccine. Also on that page is pertussis, which is the medical name for whooping cough, also caused by bacteria. The DTaP shot, or the DTP shot, that is one of those are two of the diseases that are prevented by that immunization, the third being tetanus. Excuse my cough, I've got a tickle. If you turn on to page 443, we have gone suddenly from the newborn period into adolescence, which we sometimes think of as the teenage years, the years when secondary sexual characteristics begin to develop. And we see some words associated with eating disorders: anorexia, binge eating, bulimia. Anorexia is a body image distortion whereby people really restrict their calories, may develop unusual eating patterns. Bottom line, don't get enough calories, with sometimes tragically fatal results. Bulimia is where a different type of eating disorder, they can occur together, where after eating, the person who has it makes themselves throw up, have emesis, to use one of our words we learned earlier. Encopresis is where someone is incontinent of feces. Enuresis is being incontinent of urine. So those are problems that can occur. Coming on over, we've got some developmental problems on page 445. The first one I should point out to you, Asperger's syndrome is no longer a clinical diagnosis. You still hear it used among the lay population, and some people with this disorder still prefer to use it, but now it's considered part of the autism spectrum disorder, which is a broad term covering a lot of different communicative disorders, and they can be from relatively mild to very severe. I think everybody knows about hyperactivity disorders and attention deficit disorders. You can have attention deficit disorder with or without hyperactivity, and those can cause problems, especially in a learning environment. I think the other words, dyslexia is another broad term for difficulty in perceiving the written word, understanding written communication. All right, turning on over to page 447. We sort of skipped the rest of life, and now we're in old age, topics that are familiar to your instructor. Dementia is another broad-based term that covers problems with cognitive function. The one you're most familiar with perhaps is Alzheimer's disease. You might also know about Lewy body disease that Robin Williams suffered from. Geriatrics is the specialty in medicine that deals with old patients, and a clinician who specializes in that is called a geriatrician. The specialty itself is gerontology. Sarcopenia means not enough muscle. And currently, the thinking is many of the things that we think of as normal changes with aging and many of the maladies associated with aging really can be traced back to a lack of muscle tissue or sarcopenia. Senile means it says characteristic of old age. In lay terms, when we say someone's senile, we really mean they're displaying cognitive decline, if not to dementia, at least approaching that. But senile in medicine or senility can also mean just changes that occur with aging. It's used almost as a pathology term or a physiology term. You have to be careful with this one. I had a friend who went to the dermatologist because of some spots on her leg, and he said, "Oh, those are just senile changes." And she obviously had a little, she was only in her 40s at that time, and she had a little trouble accepting that diagnosis. So while we might say lots of changes like graying of your hair, wrinkling of your skin, that those are senile changes, it doesn't mean, hopefully, that someone is senile. It just means it's a medical term, meaning it occurs as part of the aging process. Be careful with that one. Coming on over, we have things associated with death, a great way to end our time together, right? I think you know that an autopsy is also known as a post-mortem examination, sometimes abbreviated in medical. They'll just say, you're going to get a post on that person. That would mean a post-mortem examination or an autopsy. Hospice, I think everyone knows what that is. That's a service that provides assistance to someone who has a terminal illness. So hospice providers deal with end-of-life issues, both for the patient and their loved ones. Palliative care means we're not trying to cure the problem anymore or to fix it, that we're trying to keep someone as comfortable and as functional as possible for as long as possible. Typically, it's seen, you're not going to do any heroic measures. That we've decided we can't cure this condition, we can't stop the progression of this illness, but we can change the way in which the patient and their caregivers are experiencing the illness. So it involves pain relief, nutrition, providing respite care, a lot of different things. It's characterized by an absence of heroic efforts to save or cure the patient. Let's see. And I think that that's a very cheery way to end this discussion. And I'm glad your last chapter is a short one so that you can tweak your projects and have them ready to be turned in so that I can be dazzled by your great work. Thanks for being good students this term, and thanks for bearing with me.